there's a link between sleep apnea and your health. And Danielle mentioned this. She's like, hypertension is one of the things that can happen. We talked about that. No, other things that can happen are heart arrhythmias and atrial
Yeah.
fibrillation. Yeah.
So this is a big one. So atrial fibrillation, for all of your listeners who may not be aware, so it's a heart rhythm disturbance. So when we talk about the heart, we talk about it in a few different ways. When we talk about heart disease, it's kind of a broad terminology. When we're talking about the heart rhythm, this is the electricity that pumps the heart muscle. So it's what pumps the left ventricle to pump blood to the body. It pumps the right ventricle. It helps to operate the heart muscle. It's all triggered by this electricity in the heart. And so there's an area in the heart where you have your normal sinus node, and the sinus node conducts your electricity down a normal tract. When someone has something called atrial fibrillation, certainly there's other atrial arrhythmias as well that can be caused by sleep apnea. There's an area in the left atrium, specifically around the pulmonary artery. People with sleep apnea or other risk factors such as high blood pressure, high cholesterol, diabetes, obesity, but sleep apnea specifically is a big one that cause, as Jamie had mentioned, this elevated level of inflammation that occurs, these inflammatory factors, this kind of cascade that happens overnight when people are not getting enough oxygen, leads to misconduction of electricity from that area. And all of a sudden, you get firing from these electrical impulses from this area that aren't coming from the normal sinus node. So people go into these very, very, very fast arrhythmias, and these are fast rhythms, and certain ones, like atrial fibrillation and atrial flutter, can cause a stroke, which is the biggest concern for them. One of the biggest things we do for any patient with an atrial arrhythmia, the first step should always be to check for sleep apnea. And nowadays, most electrophysiologists actually, they won't even do an ablation until, which an ablation, by the way, is a procedure that helps to try to burn off this abnormal heart rhythm. And oftentimes, just to emphasize the importance of sleep apnea screening, they oftentimes won't even do the ablation until the sleep apnea is adequately controlled and managed, because they know that they could do this procedure, burn off the abnormal rhythm, and if this patient continues to have untreated sleep apnea, it's going to come right back. And so I can't emphasize enough how important the sleep apnea management, diagnosis, and treatment is for arrhythmia prevention, overall.
Yeah, and we care about this arrhythmia prevention because atrial fibrillation can lead to stroke, right?
Right.
These patients are more likely to have stroke. They have areas of the heart where the blood pools. As a result of atrial fibrillation, as a result of obstructive sleep apnea, you can develop heart failure.
Yep.
You can develop pulmonary hypertension, right? Pulmonary hypertension, if you look at the picture, if you look at both these pictures behind us, so the right side of the heart is pumping blood to the lung. So the right side of the heart is particularly affected by those hypoxic events, those events where your oxygen saturation is below 88% at nighttime. And when that right heart does not feel like it's getting enough oxygen, it can get thicker, it can get bigger. And as it gets thicker and it gets bigger, we call that pulmonary hypertension because it increases the pressure on the right side of the heart. Now, remember, your heart is supposed to be a certain size. And so what happens is if the right heart gets bigger, if the left heart gets bigger, whatever the case may be, they have a relationship with one another. We call this like interventricular dependence. And so, depending on that, they can make this chamber smaller or that chamber smaller. And all of that affects your physiology. All of that affects kind of how you can go about your life.
As Jamie mentioned, the right ventricle. So even though we have the right side of the heart and we have the left side of the heart, even though it's one heart, we really do consider it almost like two separate organs because they're quite different. As Jamie mentioned, the right side of the heart's pumping blood to the pulmonary vasculature, so all the blood vessels that are in the lungs. The left side of the heart is pumping blood to the whole body. So the left side of the heart, if you think about it, since it's pumping blood to the whole body, it's used to this very high resistance system. It's pumping blood out against all these vessels for the whole body. The right side of the heart is actually a little more fragile. It's like the version of me in the weather in California where I say like, now I'm a Californian, I can't handle the cold. This is like the right ventricle.
Yeah.
You give the right ventricle a little bit of resistance and it's like, oh my God, I give up.
Right.
The right ventricle is used to a low pressure system. And so when you have sleep apnea, you start to raise what's called the pulmonary artery pressures. This puts a lot of stress and pressure on the right ventricle. It can cause right ventricular dysfunction as well. And even on the left side, it can cause diastolic dysfunction, can worsen systolic function. So as you mentioned, the entire heart structure is at risk for untreated sleep apnea.